Hi, welcome again to another presentation. My name is Dr. Jacinta. Today we are going to talk about infectious bronchitis. And infectious bronchitis in chicken can also be referred to as the suffocating disease of chicken. This is because the birds are not able to breathe and they appear to be suffocating. So infectious bronchitis is an acute and highly infectious viral disease of chicken, and it is characterized by respiratory signs, that is breathing signs, and also egg production, which becomes raw, or the eggs are of poor quality. And sometimes you find that the kidneys are affected, and in that case we say there are renal signs. Infectious bronchitis is spread through aerosols, that is through breathing when birds are in close contact. It is also transmitted through ingestion or consumption of materials that are contaminated with the virus, like the feed and the water. We call them the fomites. The severity of the disease depends on the virus strain. There are many strains, and it also is also affected by the bird's age. From where I come from, although all ages of birds or chicken are affected, the adults appear to be more severely affected. It is also affected by diet and immune status. By immune status, I say whether the animal or the bird has been exposed to the virus before or it has been vaccinated. So if it has had any of those two, the severity will not be as high. And also cold stress, low temperatures, they also bring about, or they make the disease to be more severe. The clinical signs of infectious bronchitis include high morbidity. Morbidity means the rate of spread from one farm or household to another. And even within a household or a farm, the spread within a flock is very high. It approaches 100%. But from where I'm talking from, the morbidity is not as high. It's normally 40% or below. So you find that if you have 10 birds, maybe 3 or 4 will be affected. The animals cough, or the birds cough, they sneeze, and they produce something called tracheal rills. Tracheal rills is like a bird is breathing through water, like there is bubbling through its throat. There is labored breathing. Sometimes you might find that the face has swollen. The feed and water consumption goes down. The shape of the eggs changes from the normal one to misshapen eggs. And the cover, which is normally hard cover, sometimes becomes soft. So we say the eggs are soft shelled. And although all types of birds are affected, the indigenous birds appear to get the infection or to have more severe infection, maybe because they are rarely vaccinated, and like the layers and the which are normally vaccinated, and sometimes to a small extent the broilers are also vaccinated. And although the disease affects all ages and all sexes, both sexes, male and female, you find that the cocks get the severe form of the disease. So in production, or in chicken production, especially the indigenous birds, the farmer aspires to have a healthy flock of birds, and from hatching, the farmer expects that the chicks will feed well, they will take their water well, and they will transform from chicks to growers very fast, and from the growers or growing stage to the adult stage, where they will reach the market size for meat, and they will also produce eggs. This is the aspiration of the farmer. But you find that when IB strikes, or infectious bronchitis strikes, the bird stop feeding and taking water, and it spends most of its time trying to breathe through an open mouth, and it will struggle to breathe, and you will find that even the chest is heaving due to the labored breathing. And although all birds are affected, I have said, oh yes, and you find that the adults are more affected, or more adults are affected, and the cocks are affected more. And you'll find that the cocks also are not able to crawl, or when they do, it's as if somebody is struggling them, but most of the times they don't even crawl. Sometimes you'll find that the tail of the cock, which is normally upward or held upward, it faces downwards. This is a sign of sickness, even in other birds, in other diseases. So it is not specific for infectious bronchitis, but it will tell you that the bird is seriously sick. You will find that the bird is pressing its head on objects like the wall, because the head is very heavy. You will find that if you look at it closely, it is open. The mouth is full of mucus, and the nose is also clogged with the mucus. And if you try to open the mouth, you'll find that the mucous membranes are red. So infectious bronchitis is a disease that needs to be controlled because of its severity. So what is infectious bronchitis confused with, or how would you know this is infectious bronchitis compared to the other common diseases? One of the diseases that it is confused with is Newcastle. Newcastle is also a viral disease that has a high morbidity and mortality. That means the birds die, many of them, like 100%. And also there is an infectious laryngomyelitis, where there is labored breathing in the chicken. But you find that laryngomyelitis, when the bird breathes out, or it sneezes, it produces, the discharge has blood. It is blood stained, and therefore objects like utensils and the wall, they are blood stained. There is also mycoplasma, which brings about chronic respiratory disease, or CRD. And the mycoplasma, the spread is not as fast as that one of the infectious bronchitis. So you'll find that if you have mycoplasma, maybe 1 or 2 birds are affected. There's also the trachea worm. There's a worm that lodges in the trachea of the birds, and the birds breathe with an open mouth. This one, you'll find that the breathing is not labored, but the bird is breathing through an open mouth. So the control of infectious bronchitis is through vaccine, and the vaccines are easily available. But the problem with this vaccine is that they are packaged in packs of 200 doses and above, whereas the indigenous bird production is of less than 20 birds. So the vaccine becomes unaffordable to the common farmer. However, the vaccine, despite all this, is highly affordable, and therefore one is encouraged to use this vaccine because the control is cheap as compared to the treatment, including the losses that one will undergo. So this brings me to the end of this presentation that deals with the agricultural extension on issues of the past, present, and the future in agriculture. So if you have liked the presentation, kindly give it a thumbs up and share it with others. Otherwise, let's meet in the next presentation.